So, before we get into the presentation, I just want to talk a little bit more about myself. I've been in this industry for about 11 years. I started with a company based in California and just grew to have an extreme passion about medicine in general. And I'm really passionate about this specific type of medicine because I think it's the best medicine out there, and it gets no better. I come from a larger company, and I manage the Southeast, so I manage all of Florida, Alabama, Georgia, and I started out and just worked my way up in the company, and I love educating. So I'm sure you're going to get a lot out of this because I think this applies to everyone in the room, sleep as well as stress, because some of us are stressed from work, kids, different things, give you money. And then some of us don't manage our sleep well. So we're going to go into these two topics in depth. We're going to talk about the stress response, exactly what happens when you have a stress response at a biochemical level. What's cortisol? What hormones are going off? How does it affect you? What's acute stress? What's chronic stress? And then we're going to talk about how to manage it. So how do you, at a practical level, involve people like Dr. Weiner and your healthcare practitioners, as well as understand what protocols can really help you when your stress load's too heavy or when you're not getting enough sleep. So we're going to go into the presentation. I promise I won't bore you. It's about an hour at length, and I really want you to pay close attention because a lot of what I'm saying applies to what you're dealing with on a day-to-day basis. All right? So here's our agenda. So we're going to go into facts and figures on stress. I think everyone should know about some of the common side effects of stress medications, exactly what they do at a biochemical level in terms of the drug therapy that's on the market. We're going to go into the protocols for managing stress, and then we're going to go into the same bullet points for sleep as well, facts and figures on sleep, side effects of sleep meds, as well as protocols for managing sleep. So stress can play out in many different ways, all right? Some of us are stressed and tired. I was just talking to a gent that said he doesn't sleep, but he may be so wired, he may be stressed and wired to the point where he really can't allow his body to get appropriate rest. Stressed and hot. So some of us get stressed, and how our body responds to it is our body takes on stress in the form of inflammation, where it leads to chronic disease, heart attack, metabolic syndrome. Stressed and cold. Some of us are stressed, and because of that, our thyroid doesn't function properly. So we have thyroid issues. Stress and hunger cravings. How many of us get stressed and we take it out on the fridge or take it out in the cafeteria or the supermarket, however you want to describe it. But when you get stressed, the key stress hormone is cortisol. So a lot of the time when that's elevated, it actually causes carb cravings, sugar cravings. So we'll talk about that a lot more in the presentation. And then how many of us have disturbed sleep and mood? We're so stressed about certain things, we don't sleep well, or it affects our mood. And then it affects the loved ones around us, right, as well. So stress has many different faces, many different aspects in terms of how it plays out. So here's some random facts about stress. Stress has been called the silent killer, similar to blood pressure, because stress can lead to heart disease if it's not managed well. It can lead to high blood pressure, chest pain, irregular heartbeat. And this is all in the medical literature. Stress can alter blood sugar levels, so it actually can cause hyperglycemia, metabolic syndrome, and major risk factors for heart attack, and diabetes as well. Okay? Laughing lowers stress hormones, right? So we all want to laugh, and it lowers, some of the key stress hormones, which are released when our body is going into the stress response, like cortisol, epinephrine, and adrenaline as well. And it strengthens the immune system. So who wouldn't want to have a stronger immune system, right? With all these things going around. In 2009, there was a CNN poll done that actually revealed that the number one reason for stress in most countries is money. And I found it interesting that there's really no third world countries up here. The countries most stressed about money are Malaysia, China, Singapore, and the U.S. So the countries less stressed about money are Russia, France, and Italy. So, and then chronic stress, that increases cytokines. Cytokines are basically inflammatory messengers. So these inflammatory messengers send signals to our body to actually go through an inflammatory process. Okay? And inflammation leads to all these things: heart disease, high blood pressure, all these different diseases that we want to try and avoid. And inflammation also damages arteries and other organ systems. Okay. So this is just one sound bite. This is just one anxiety. It's an anti-anxiety med. And this is the U.S. Food and Drug Administration alert on this specific drug. So there was a warning issued on clonazepam. There's a risk of suicide and suicidal thoughts. But they say, hold on. If you're taking that and you're worried about these side effects, just go talk to your doctor. Just go talk to your practitioner about it. I think that's a joke. You know, not to say that you shouldn't talk to your doctor about it, but those are some pretty serious side effects. And these things are all over the media, between Valium and all of the potent drugs, the drugs that are supposed to help you manage anxiety. But what happens a lot of time is they can cause other side effects. So there's a place for drugs, but we need to put it more in perspective. Drugs are more for acute medicine, right? More for acute things. And we have a great model in terms of healthcare for acute disease. But what do you do with managing things long-term like stress, anxiety, okay? Some of these things don't go away. You know, there's no magic pill. And it's a lot more intricate and involved. So we'll go a lot more into that throughout the presentation. But this was right out on WebMD, and it's all over the FDA website in terms of FDA alerts on anxiety medications. So what does a stress response look like? How does this play out in terms of the chain of events? So you have neurotransmitters. Neurotransmitters are messengers in your brain, okay? So neurotransmitters are released. They trigger an increase in emotional response. They can influence memory. They can inhibit certain things. They can, you know, enhance concentration or inhibit concentration. And they can cause irrational or irrational thought, okay? The adrenal glands pump out a hormone, and this is our primary hormone that you hear referenced when we're in a state of fight or flight, which is cortisol, okay? Cortisol is our way to manage and deal with stress, so our body pumps that out, and the adrenal glands are responsible for that again. But pumping out too much cortisol can be inflammatory, okay? So we want to keep that in moderation. When the thyroid gland is stressed, it pumps out hormones that accelerate metabolism, so T3, T4, right? And we all know what can happen with the thyroid when it's out of balance, hyperthyroid. Sex hormone levels may be impacted by stress. So this could cause a loss of libido, sexual desire. Glucose metabolism may change as a response to stress, where glucose is released and our blood sugar raises, right? And then we have digestion, heart rate, respiratory function that could all be compromised just by the stress response. Us having too many of these stressful events and that stress response wreaking havoc. So what's the role of the central nervous system? The role of the central nervous system is kind of like an operating system on the computer, right? It's kind of like the backbone, right? So you have software on your computer, you click on it, click and point, right? And the software opens up, whatever that is. So the central nervous system is like an antenna. It translates whatever stress or stressor is coming about, and it translates that into biochemical signals. You start this whole response, this whole stress response, right? The limbic system stimulates a hormone, and we're not going to go into all the different hormones here. And then once this specific hormone is released, corticotropin releasing hormone, it then travels to the pituitary gland where it triggers another hormone. Once that hormone is triggered, then you have the release of cortisol from the adrenals, okay? We have something that's great for adrenal support. It's called Adrenamax 2. So Adrenamax 2 basically helps buffer. It's like your buffer for this whole stress response. It's going to help manage cortisol better and help manage this whole stress response better. So as you're perusing the wellness week here, or if you're just here for today, take a look at it. It has some great ingredients in there. It has some adaptogens. Adaptogens are known to help the body provide a good defense mechanism against stress. And you have a lot of other things in there that could really help buffer the stress response. So this is basically the stress response. And then we have the hypothalamus that stimulates the sympathetic nervous system to release epinephrine, norepinephrine. So epinephrine, then adrenaline as well. Okay? So how do we manage stress? How do we do it effectively, right, without having to resort to medications, hopefully? We have Calm Day. Calm Day is a very unique formulation, so it's got some amino acids in there. It's also got you have taurine, glycine, which are specific amino acids, and you have something called 4-amino-phenylbute, vitamin B5, B6. B vitamins are great for buffering the stress response and supporting neurotransmitters. And we're going to go through each of these ingredients so that you know what role they play in the formula. So phenylbute, if you don't want to say that long word, I think it's pretty long. It's just phenylbute in the parentheses there. It's similar to the brain chemical GABA. Now, some of you may have heard of GABA. It's a neurotransmitter. It has a calming effect on the brain. So that's the role that it plays in terms of the neurological effect that it has. So the challenge with GABA is when you take it orally, and it's in the research, it does not cross the blood-brain barrier. If it doesn't cross the blood-brain barrier, it's very questionable if you're even going to get any effect from it. So phenylbute is actually a precursor to GABA, okay? And phenylbute crosses the blood-brain barrier. Now, you do have GABA that's provided orally on the market. I would definitely question if there's any effectiveness there, because it's all in the research that when you take GABA orally, it doesn't cross the blood-brain barrier. Okay, phenylbute is also extensively researched in Russia, and it's studied for its ability to prevent the negative effects of sleep deprivation. Okay, so not only are we dealing with stress, we're also dealing with sleep. Right, so a lot of the time when we're too stressed, it also affects the sleep, right, the sleep cycle as well. And it's also researched for its ability to reduce anxiety, and it's commonly used in Russia to improve anxiety as well as sleep disorders, depression, and post-traumatic stress syndrome and post-traumatic stress disorders. So that's phenylbute. Glycine is a non-essential amino acid. I'm sure some of you have seen glycine before. It also plays a key role in detoxification. But in this specific instance, we're dealing with stress. So it's been studied for its ability to protect the brain cells, as well as promote a sense of well-being and reduce anxiety as well. So a common theme that you'll see here is, improvements in anxiety, helping us deal with anxiety better and reduce anxiety. It's also been shown to improve sleep quality. So again, there's a lot of crossover here in terms of stress, sleep, and actually impacting both areas through some of these ingredients that are in the Calm Day. Okay? We also have taurine. Taurine's an amino acid, and it has a GABA-like effect. It actually attaches itself to the GABA receptor, which is in the brain again. So we're impacting the neurotransmitters in that fashion. And again, GABA is a sedating, inhibitory neurotransmitter and has a very calming effect. And again, you see sleep, which is going to be a recurring theme through some of these stress slides, but taurine is sometimes used to enhance sleep quality as well. And then you have your B vitamins. So B vitamins are very, very key to being involved in nerve transmission, nerve regeneration, neurotransmitter synthesis. And we're going to go through all of the neurotransmitters and the specific role that each of them play, just so that for some of you that don't know about the neurotransmitters and the key roles, we'll go through that in depth. But vitamin B5, it's water soluble, and it's used by the body to manufacture coenzyme A. Coenzyme A is very important for energy metabolism and the production of fatty acids, cholesterol, and the neurotransmitter acetylcholine. So this is the mother neurotransmitter for memory, okay? So when the memory is not working well anymore, it's because acetylcholine has been affected. All right, so B6, that's also water soluble. We have it in the preferred form, which is the pyridoxal 5-phosphate, okay? And that is really the preferred form. So if you look on your label, if you're, if you are looking at B6 and trying to identify, is this a quality B6 or in the preferred form, you want to look for that specific verbiage on the label. And B6 is used in the conversion of tryptophan to serotonin. So serotonin is also a key neurotransmitter that's involved in sleep, okay? So this is helping with sleep as well. We're also impacting Gaba, dopamine. Dopamine is responsible for concentration. Serotonin involved in sleep, epinephrine, norepinephrine, 2 key hormones involved in the stress response, okay? So for Calm Day, this is the protocol. And this is in line with what Dr. Weiner does in his practice as well, for all of you that see him. You want to start with 1 cap in the morning, 1 cap in the evening on an empty stomach. And you should feel it within a few days, usually 1 to 2 days, okay? And we're so confident that you'll feel the effect that we actually have it in an 8 count, okay? We also have it in a 60 and 120 size. So you have the ability to take the 8 count, get it in your system, see how you feel afterwards, and then transition to a bigger bottle size, okay? So this is going to improve focus without making you tired as well, okay? So work specifically in the daytime to help you deal with the stress response without making you tired, okay? We spoke a little bit about how stress plays out, and a lot of us get the carb cravings and sugar cravings when we're dealing with stress. So we have control that is actually specifically formulated to help us deal with stress and not have all these cravings that come about. And this is exactly what's in control. We have tryptophan, relora, and rhodiola, and L-theanine. L-theanine is an amino acid. It comes from green tea. We'll talk more about these specific ingredients. But control helps decrease insulin resistance, right? So when our blood sugar goes high, our body may take on a form of, issues with blood sugar where there's insulin resistance that comes into play. We also have neurotransmitters that we're balancing. So we're balancing things like GABA, serotonin, dopamine, all of the neurotransmitters that I went through in the prior slide. And we're also helping control carb cravings and sugar cravings as well, and we're rebalancing cortisol. So remember, when cortisol goes too high, a lot of the time that's what brings on this vicious cycle of the carb craving and sugar craving. So that's the key hormone that we want to make sure we keep in balance. Theanine shown to positively affect both dopamine and GABA levels. So we're looking for enhancement in mood and reducing stress as well through impacting both of those neurotransmitters. Then we're also influencing a generation of alpha brainwaves, and these are important because as you're sleeping, these brainwaves are at work, and it helps us stay in a relaxed state of sleep, and it also helps us stay alert as well. And in a 2004 National Institute of Mental Health crossover sleep study, they found that just 200 milligrams of theanine taken 1 hour before bedtime as a single agent is great for 6 days for dealing with stress, okay? So all the participants reported significant absence of feeling exhausted upon awakening after a full night's sleep. All right? So that's stress. So you have Calm Day and Adrenamax 2. Adrenamax 2 is more for adrenals, burnt out adrenals, adrenal exhaustion, help deal with the stress response. Calm Day has your B vitamins, your amino acids, as well as phenubute, which is a precursor to GABA, has a calming effect. So you put both those together, or you may want to try and take them individually, all right? So we're going to go into sleep, and this affects so many of us. 60 million Americans suffer from disturbed sleep quality, characterized by functional impairments during the day. Between a third and half of Americans suffer from insomnia and complain of poor sleep, okay? I've woke up at different times throughout the week. I don't know exactly why, but just wake up, I'm checking my email. Sometimes I just don't know how to shut it off in terms of thinking about work stuff. But, all of us are dealing with this in some kind of way. And, you know, it really affects how we perform throughout the day, you know. So really what we're looking for here is improvements in performance, your overall day-to-day performance in terms of what you're doing on a day-to-day, that you're being productive, and that you're able to have a good night's sleep, okay? So the practice of burning a candle at both ends has created so much sleep deprivation that what is really abnormal is now almost the norm for a lot of us. So here's the types of sleep medications out there. So you have benzodiazepines, and they're primarily for, you know, they're anti-anxiety medications, and these are the things that could lead to, you know, the suicidal thoughts, suicide as well. And they increase drowsiness and help people sleep, but they're also potentially addictive. So barbiturates, they actually depress the central nervous system and cause sedation. This is what's used for local anesthesia, so these tend to be pretty safe because they have a specific function in medicine. And then there's various other hypnotics, but how sleep medication works is they make you breathe more slowly and less deeply. Now, I don't know if breathing less slowly is really the right thing to do here, but we're going to go through some solutions that you want to, you know, may want to consider versus, you know, looking at these different options here. So here's the FDA warning. You know, you got Valium up there, benzodiazepine again, commonly used RX meds for sleep disorders, and they can disrupt performance and be addictive, right? And I mean, we're all adults in the room, or at least most of us, but you know, think about the effect that this may have on children, because a lot of the children are actually being prescribed these meds now.
Oh, that's bad.
Yeah.
That's real bad.
And I'm going to give you the name of a specific YouTube video. There was a Harvard professor, I believe it's called it's going to list the title in a presentation later, but they basically did a lot of research on sleep meds. And in the US, they found that sleep meds are only 14% effective. 14% effective in terms of how many people actually get a positive benefit from it. It was actually a Harvard medical doctor that's doing a lot of research. I believe it's called the placebo effect. So yeah, I'll make sure I leave you with the title on that one, because it's astounding that some of these meds are being looked at as standard of care for anxiety, and they have a placebo effect. They're not doing much for the patients.
That's right.
So,
Good for the father.
Yep, exactly. So here's some of the things that you maybe did not know about sleep medications. That's a little scary, okay? So this is more of the complex side effects of sleep medications. And these typically occur when the doses increase on a sleep medication, and we don't necessarily know how the person is going to respond in general to an increase in dosage until the response takes, you know, until it's at work, right? So here's some of the things that could be at play when there's increased dose of sleep medications. So parasomnias are actually behaviors and actions over which you have no control. So this could be sleepwalking, sleep eating, okay? I was reading an article actually as I was pulling the research, and there was a female that was saying that she, before she went to sleep, she always ate one small piece of chocolate. And she said she started taking a sleep med. It didn't name the specific sleep med, but she woke up after taking the sleep med for about a week, and she had a big chocolate cake next to her. She had no idea that she even ate it. It was like halfway eaten. She had no idea. But they characterize that as sleep eating. Yeah, sleep eating. Making a phone call or having sex while you're in a sleep state. Okay, so these are very complex side effects of sleep medications that you want to be aware of, okay? Sleep driving, okay? So you're driving, but you're not in an alert state as you're driving, okay? So a lot of these things can cause different issues, but I just want to educate you and make you aware of what's actually in the literature on how these sleep medications, you know, what can potentially happen if there's these complex side effects, accompanied by a laundry list of about, I found about 60 other side effects. I just bullet pointed a few. because I didn't want to overwhelm you guys with the side effects. But you see it's a laundry list. A lot of D's up there: dry mouth, daytime drowsiness, dizziness, difficulty keeping balance, diarrhea, constipation, change in appetite. So yeah, it's just, that's what happens. Yeah. it's a lot of side effects. Mental slowing or problems with attention and memory. So some of them, I guess, are having too much of a sedative effect. And here's all the different ways that, sleep can play out in terms of not getting good sleep. Difficulty falling asleep, difficulty waking up. We have daytime drowsiness sometimes when we have the difficulty waking up. Sometimes we're waking up frequently throughout the night. How many of us wake up and it's hard for us to get back to sleep? Sometimes?
I woke up at 2 o'clock in the morning and started filling out my income tax.
There you go. Hey, at least you'll make it before the deadline, right? At least you'll get it before the deadline. How many of us zone out? Don't zone out when your wife's talking to you or when your mom's talking to you. Difficulty concentrating, right? Clumsy and or slow reaction times. Feeling emotional when not getting enough sleep. And then altered memory and judgment, right? So deep, refreshing sleep and relaxation can be achieved naturally, okay? So we're looking at natural approaches here. We're looking at balancing neurotransmitters, which these are the key ones involved in the sleep cycle: serotonin, dopamine, and Gaba, without producing all of those side effects, from the complex ones to the other ones that you saw on the slideshow there. We're stimulating the alpha brainwaves, which are associated with an awake yet relaxed state. And we're promoting healthy serotonin levels. The serotonin is a key neurotransmitter involved in the sleep cycle. So we want to encourage falling asleep and going into a deep sleep where we sleep throughout the night. Okay, so let's go into neurotransmitters a little bit. I've kind of spoke about it throughout. So here's the role that each of the specific neurotransmitters are involved in the sleep cycle play. So you have serotonin that influences mood, appetite, and sleep. So these are one of the key ones. We also have dopamine, influences mood, and there's a possible depletion of dopamine during our REM sleep cycle, and we'll go through the sleep cycle as well, how that works. And then we have Gaba. Gaba has a calming effect again, and it impacts mood, cognition, and sleep disorders. And you have a possible depletion of Gaba there during the REM sleep cycle as well. So here's our natural sleep cycle. So if you want to know what occurs while you're sleeping in terms of what's going on. So first we fall into a light sleep. Then we move on to intermediate sleep. Most of the night is spent in this stage, this intermediate sleep stage. And this helps refresh the body, okay? Then we have deep sleep, right? That lasts about 30 to 40 minutes in the first few cycles. And then we go into the REM part of the sleep cycle where dreaming occurs and our heart rate increases. This lasts about 10 minutes. Now, during a full night's sleep, you repeat the sleep cycle 4 to 6 times from one stage to another, okay? So how can we help improve the quality of the sleep cycle naturally, okay? We have sleep time, okay? Here's actually the YouTube video, 60 minutes to placebo effect. And I actually want to see if we can play the video. So here's the title of that video, 60 minutes to placebo effect. And again, it's a Harvard professor and a Brown professor questioning the effectiveness of the, the drugs, antidepressants. Yeah, so we've got tryptophan in sleep time, and this has an effect on serotonin. That's that neurotransmitter that they mention in there that the antidepressants are specifically targeting. Okay. It also helps with balance of mood, appetite, sleep, sexual behavior, and pain sensation. It's well tolerated, has a great safety profile as well. Here's some of the other things that tryptophan does is it actually increases our REM sleep, helps regulate sleep, and improves sleep quality during the key stages of the sleep cycle. And when using for sleep, 200 milligrams per day may be preferable to higher doses. Okay, so you have sleep time as an option, But you also have calm days. So calm days is your daytime solution. That's more for anxiety, right? And then sleep time is your evening solution to help you get to sleep, stay asleep, and of course feel rested when you wake up the next day. You don't want to take this if you're taking any benzodiazepines. If you're taking any of those meds, you can't take the calm day and the sleep time. What you'd want to do instead is go with these specific protocols, the Neuromax, that has your B vitamins. We also have dimethylglycine, which helps with the production of serotonin. It's a precursor for serotonin as well as some key amino acids that are involved in the sleep cycle, like glycine and taurine. Super B Complete. It's a comprehensive B vitamin formula. And then we have omega-3D, that's your omega-3. And you want to take the dosage recommended here. 2 caps a day for Super B Complete. Omega-3D, 2 in the morning, 2 in the evening. That's a little bit about Super B Complete. We have the body-ready form of folate, which is called 5-methyl tetrahydrofolate. Some of us have a genetic deficiency in terms of not being able to convert folate into the body-ready form. So it's a specific genetic SNP. And if you're not able to do that, this is the best form to go with. If you just get folate, your body actually has to convert it over. We also have methylcobalamin, which is your active form of B12, B6 in the preferred form, and then you have more B vitamins. And we also have dimethylglycine, which is, again, a precursor for serotonin, as well as glycine. 2 key things involved in the sleep cycle. Okay, so I spoke about B5 earlier, but this is how it relates to sleep in terms of the impact it has on sleep. So it helps if you take it before you go to bed. And this is also your antidote to too much cortisol. So that's that specific stress hormone. If it's too high, it causes all these issues, cravings, and different things. It's also important to help manage stress levels and insomnia as well. Okay?
It's on the B Complete.
Super B Complete. Yep. And here's the 5-methyl tetrahydrofolate, methylcobalamin, a little bit about the B6. But I'll be quick. Your B6 is impacting your neurotransmitters directly, right? Serotonin, key one involved in the sleep cycle. Melatonin as well. A lot of us know about melatonin. Melatonin is a precursor to serotonin. 5-methyl tetrahydrofolate, again, that's a body-ready form of folic acid. And this may exhibit antidepressive effects. And then you have B12, which actually helps with depression as well as restless leg syndrome. All right? And we have B12, that enhances sleep. There was a specific study done on B12 in the form of methylcobalamin. There's 2 specific types of B12, methylcobalamin and cyanocobalamin. Okay? This study that was published in Neuropsychopharmacology in 1996 found that just taking 3 milligrams of B12 was beneficial for sleep problems. And it affected melatonin levels, and it helped regulate the sleep-wake cycle. They tested this with the same population of patients with cyanocobalamin, and they found it wasn't effective. So this is the most effective form of B12 for sleep to help enhance the sleep cycle. And we can alleviate symptoms of depression if the depression is linked to low B12 levels as well. And here's some other key formulas to help promote sleep. We have melatonin, okay, and that's in the Nutritional Frontiers brand again. We have it in 1 milligram. This is good for children under 12 years. We have it in 3 milligrams, which is a chewable sublingual. It's a different type of delivery system. It's a chewable. Then we have a sustained release. So it releases when it needs to release throughout the sleep cycle, helping you stay asleep. And then here's some herbal tinctures. The herbal tincture that we have available if you don't want to take a pill. This is what we have for relaxation and sleep. So it's a dropper. We also have Frontier Minerals. And if you're having issues with muscle soreness, muscle spasms throughout your sleep cycle and it's waking you up, we have the Mag Complete. Magnesium helps relax the muscles. Okay, that is the conclusion of the presentation. Thank you for your time. And everyone that needs a copy of the slide deck, I'll make sure I get you a copy. And if anyone, that video, you just YouTube it, 60 minutes placebo effect. and you'll get it there. And it's 13 minutes, so the video is 13 minutes in length.
That's good.
Thank you.
Thank you.